April 2025, the Cornwall Regional Hospital in Montego Bay, St. James achieved a significant milestone on its journey to renewal with the start of phased reoccupation of the main building. The opening of the administrative department on the main building, which is in its final phase of comprehensive rehabilitation, provides a view of the modern look and feel all other areas of the facility will exhibit on completion. Key features of the work on the facility include improved ventilation and lighting systems, upgraded IT infrastructure to support efficient operation, and enhanced accessibility features to staff and visitors. Modernized office space to promote productivity and staff rejuvenation is also provided.
Some may argue why we start with administration, why not with ward space? The truth is that a plant requires management in the first instance, because all the moving parts have to be coordinated. And to put in ward space without having a kind of management coordination and presence or an IT system to track records and to ensure that the overarching coordination takes place would make it a bigger logistics challenge than it would be otherwise. So we're really starting where we need to start, deliberately so, as part of phasing in the full-fledged operation of the institution.
This ultra-modern, comfortable environment with all new furnishings will now house the Office of the Chief Executive Officer, accounting, procurement, office management, and general administrative services. The block also features additional critical facilities to include a kitchenette, restrooms, reception, and waiting areas. It is expected to boost morale and enhance staff's ability to serve patients more effectively.
This moment represents a significant step. Our dedicated administrative team will now be able to work together under one roof and on the one compound, strengthening our capacity to serve both our staff and patients more effectively. I want to acknowledge the unwavering support of the community and the staff, the Ministry of Health and Wellness, the Western Region Health Authority, and all our partners whose hard work and resilience has brought us to this day.
It's a lot of humility that we come here to celebrate. The small wins that combined will become the big win. And the big win obviously means a win, not just for the staff who are here, but for the people, importantly, who will benefit. Today is a good day in public health.
According to the Minister of Health and Wellness, it's a transformation that epitomizes modernity and a model to replicate in healthcare across the country, including the new Western Child and Adolescent Hospital being built next door on the Cornwall Regional Compound.
We know this is the final phase, but also still a journey that we have to travel. And so we're under no illusions that the work is complete.
The rehabilitation of the main building at Cornwall Regional Hospital was triggered following a ventilation problem and further detection of leaking pipes, faulty electrical system, and damage to the roof and support structure of the building.
When we talk about doing it right, the government of the day said, abandon the patchwork. Let us just build a new Cornwall Regional Hospital. So we went back to the drawing board, brought in the architects, brought in the engineers, hired overseas support, and we rescoped the project. And as a result of that rescoping, we have determined an estimate of some 23.5 billion, which includes all new equipment.
The main building was stripped down to the bare bones with all windows and doors removed, electrical and piping systems, roof and chimney cleared for replacement with all new material and furnishing. Critical repairs were also done to correct structural damage. With the admin department first to be back on the block operating, several other departments and services are on the schedule for phased reopening over the next year. These include a server room, medical records, general stores, dietary services, and wards. The facility will also have a new maternity suite, intensive care unit, accident and emergency department, and nursery and operating theaters. It is to be outfitted with new technology and infection prevention control finishes. All furnishing and equipment to outfit the building will be new, including diagnostic machines. The extensive repairs and overhaul of the hospital will total some $23.5 billion, including the cost for relocation of services and the restoration of the main building, set for completion in the first quarter of 2026.
$1.8 billion has been spent to ensure that service provision continued outside of the main building. So that's what was spent to double the Mount Salem Clinic to be a proper accident and emergency, establish the diagnostic center, convert the nurses' quarters into inpatient care, set up the 2 additional operating theaters down at Falmouth. That was spent in a way to preserve the services, but indirectly also expanding the quality of service provision in the region. To date, $3.9 billion has been spent on the main building, and that building out continues.